I'm Dr. Charles Moak. I'm going to show you a pellet insertion into a woman. You can see she's laying on her stomach, and this is her right butt cheek. You should look at her boots down here at this end. You get her context. So I've already pre-numbed her. I put a little anesthetic in, about 10 cc's of a diluted lidocaine with epinephrine, so there's no bleeding or bruising typically. Make a little edit. I kind of did it inside the underwear line. And I have what's called a trocar here, which I'll assemble. And this allows me, it's kind of blunt here, so it's angled and it's blunt. So I would go through the little incision, go down into the subcutaneous fat, nice and deep. I pull this back out. And I have 3 pellets here. One's a 100 milligram testosterone pellet. A woman has about 20 times more testosterone than estrogen when she's premenopausal. Postmenopausal, they both go away. There's a 25, that's a 100 milligrams. This is a 25. It's usually 1 milligram per pound, so she's about 125 pounds. And I'm putting in 6 milligrams of estrogen. Again, 1/20th as much estrogen as testosterone typically. And I have another trocar that's flat-ended, and I put it in. And I kind of just push a little further so it's getting down in her tissues. I'll hold my hand here so the pellet does not extrude. I can always check it to make sure it's in there. And it is. And that is a pellet insertion. It takes about a minute. And then I put a little steri strip on here, which is basically a little tape. Doesn't need a stitch at all. And it'll heal up. And she's had several pellets before. I can see a little mark right there, but typically you cannot see the scars. The pellet kicks in about 2 weeks or so. And it's really a good way to get your hormone replacement without having to think about taking a pill, which your body makes something called sex hormone binding globulin that kind of binds all up. The topical sometimes call it irritation, but that does work. But testosterone particularly, which is very favorable in terms of breast cancer protection and solving all symptoms of menopause, it's not suitable for a topical or injectable in women, so the pellet is ideal. So then we add the estrogen in, and then when we do that, we also give women progesterone orally. So testosterone, usually a milligram per pound. Estrogen, usually 1/20th as much as testosterone. And then progesterone is typically 200 milligrams a day, taken orally at bedtime, helps you sleep in the menopausal state. So that is a testosterone pellet, testosterone, estrogen. Again, the progesterone is oral. Thank you very much.